The spinal cord is protected by a bony structure known as the vertebral column, or backbone. It is a flexible, curved tower of bones that supports the head and torso while acting as a conduit for the central nervous system. The column is made up of 33 individual bones called vertebrae, which are categorized into 5 distinct regions. 1. Cervical vertebrae, neck. There are 7 cervical vertebrae, C1 to C7. These are the smallest and lightest bones of the spine, designed for high mobility to allow the head to turn and tilt. C1, atlas, lacks a body. It is a ring of bone that supports the skull. C2, axis, features a tooth-like projection called the dens odontoid process that acts as a pivot point for the atlas to rotate. Specifications. They contain transverse foramina, small holes, for the vertebral arteries to pass through to the brain. Thoracic vertebrae, mid-back. There are 12 thoracic vertebrae, T1 to T12. These bones are heart-shaped and larger than the cervical bones. Articulation. These are the only vertebrae that attach to the ribs. Specifications. They have long, downward-pointing spinous processes, the bumps you feel on your back. Their movement is more limited compared to the neck, to protect the vital organs in the chest. 3. Lumbar vertebrae, lower back. There are 5 lumbar vertebrae, L1 to L5. These are the largest and strongest because they bear the majority of the body's weight. Structure. They have a thick, kidney-shaped body and a short, blunt spinous process. Specifications. This area is the most common site for herniated discs because of the immense pressure placed on these bones during lifting or twisting. Sacrum pelvic region. The sacrum is a single, triangular bone formed by the fusion of 5 separate vertebrae, S1 to S5, in early adulthood. Function. It strengthens and stabilizes the pelvis. Specifications. It connects the spine to the hip bones, forming the sacroiliac joints. 5. Coccyx tailbone. The coccyx is the terminal end of the spinal column, formed by the fusion of 4 small, rudimentary vertebrae. Function. While it is a vestigial tail, it serves as an attachment point for various muscles, tendons, and ligaments of the pelvic floor. Key structural components. Every typical vertebra, except C1 and C2, shares these specifications. Vertebral body, the weight-bearing solid front part. Vertebral foramen, the central hole through which the spinal cord passes. Intervertebral discs, pads of fibrocartilage between the bodies that act as shock absorbers.